everybody, welcome back to my channel. So today we are going to do inhaled medication, administration of the inhaled medication for the Osce. So let's get started. It's quite a difficult topic because what happens is people get confused with peak flow and inhaled medications. So make sure you practice it every day before the exam to get it right. All right, let's get started. So first of all, you are going to do the pre-procedure check. You will check for the scene safety. You will maintain patient privacy, and if it's a community setting, you need to make sure the doors are closed or the curtains are there to maintain the patient privacy. After that, you are going to perform hand hygiene as usual, but make sure if you are being asked not to do it, you can start from the introduction. Okay, so with the introduction, you're going to introduce yourself, tell the patient that why you are there, and then gain consent. And if it's a community setting, you're going to ask the patient name, date of birth, and full address instead of hospital number. The next step is you're going to ask for the allergies and reaction, and then patient comfort. That is most important. Okay, before doing any procedure, you are going to ask the patient, are you in pain, or if they are having any concerns about the medication or about anything else. So that's the important point you need to remember. Then we are going to start with the preparation. So for the preparation, since this is a medication, you need to review the prescription first. Okay, follow the 6 R's while preparing the medication. So you need to include patient details, drug name, batch number, expiry, dose, route, frequency, time, prescriber signature, and bleep number. And then you have to state if the prescription is valid and legible. Okay, that's the most important bits for the prescription review. Okay, and then how you're gonna do it, you can say that I'm going to review the prescription. You can do it in front of the patient. Okay, and this prescription is for the patient name, then the date of birth. Okay, then if they are allergic to anything, you need to mention that there. And then you can say this is the medication, the medication name, right medication, right patient, right dose, right time, right frequency, and the prescriber signature and bleep number, the documentation. If everything is there, you need to state it loud and say this is a valid and legible prescription, I'm happy to proceed. Okay, after your preparation, you are going to start the actual procedure. So with the actual procedure, there are two things you need to remember. You need to set your equipment first, which is the inhaler and the spacer device. Okay, so for the inhaler, you need to shake the inhaler for 2 to 5 seconds to ensure the medication is mixed properly. After that, you need to take the spacer device, make sure it's a new one or sterilized one which you are using. Okay, then you need to remove the cap of the spacer device and the cap of the inhaler, and then you need to fix it. Normally what happens is you are going to fix the mouthpiece of the inhaler at the end of the spacer device. So now your equipment is ready to use. After that, you need to make sure that your patient is comfortable sitting upright. Okay, the upright position is important here because it will allow full expansion of the diaphragm, and then medicine will reach the deeper branches of the airways. Okay, after that, you are going to ask the patient that hold the spacer device into your hand, okay, horizontally, and then patient can exhale completely and then grasp the spacer's mouthpiece immediately, make a seal around it. Okay, and then tip the head back slightly, inhale slowly and deeply through the mouth, and then depress the canister. So they are going to do 3 things at the same time. Tip the head back slightly, inhale slowly and deeply, and then depress the canister. So this is the way we are tipping the head back slightly because the medication won't hit at the back of the throat. Okay, so if we will if you are going to explain it to the patient this way, it will be easy for them to understand. You can tell them that you need to tilt your head back slightly, so medicine will not hit at the back of the throat, it will go directly into your airways. And then if the patient asks like, why are we going to use the spacer device, you can tell them that spacer devices are used to provide correct dose of the inhaled medication, okay, and to allow medication to be distributed to airways during inhalation. And then with the spacer device, patient have to breathe in slowly and deeply, and breathe in slowly and deeply and breathe out normally into the spacer device for 5 times, okay. And then fifth time you can just remove the mouthpiece of the device and then exhale slowly through the pursed lips. All right, and then you're going to just demonstrate the procedure, okay, to the patient how they are going to do it. You are going to count 5 breaths, and tell them the sixth one you are going to breathe out through your pursed lips. And then you can explain to the patient, if they are given the same medication, 2 puffs, they need to wait for 20 to 30 seconds in between the puffs. And if they are given the entirely different medications for the inhalation, they need to wait for 2 to 5 minutes. And one more thing is important in the medication, in inhalation medication, that they need to, if they are prescribed bronchodilators and steroids, so they need to take bronchodilators first instead of steroids. It will enhance the effectiveness of the medication and avoid the side effects. All right, and then after that, after explaining the procedure, you can tell the patient, we are going to clean the spacer device according to the manufacturer guideline and to minimize the risk of the infection. And you can cover it back, the mouthpiece of the inhaler, you can just cover it back and put it there, clean the spacer device, and then tell the patient that I'm going to date and sign the drug administration to maintain accurate records and to avoid any duplication of the medications, okay. And before you leave the patient, you need to make sure that your patient is comfortable, the safety is acknowledged, for example side rails, height of the bed, or if they need water. And at the end, you need to always thank the patient, which is very important. Most candidates, they don't thank the patient, so you just need to say it, yeah. And then one thing I didn't mention throughout the procedure, you need to maintain hand hygiene, because we are not using PPEs here, we are not using gloves or anything, apron. So you need to make sure that you maintain hand hygiene. In between, every time you touch the patient or anything, you need to maintain hand hygiene. And please don't get confused with inhaled medications and peak flow. So when I was preparing for this, I always get it wrong sometimes with the preparation, so make sure you don't mix it up. So the difference between inhaled medication and the peak flow is, in the peak flow meter, patient need to take a deep breath in, okay, and then give a short sharp puff. But here they need to exhale completely, okay, and then grasp the spacer mouthpiece. That's the only difference, okay. If you practice it every day, you can make it. And then that's it for today. And medication administration, if this is because this is a medication, inhaled medication, it's a medication, right? So you always need to double check the patient ID before giving the medication. So the second time after reviewing your prescription, you need to come, when you come back to the patient, you need to ask their name, date of birth, and the address again, if it's a community setting. And if it's a hospital setting, hospital number you are going to say to the patient to confirm it. All right, I hope this video was helpful, and if you have any questions, please don't hesitate to ask me. Share this video with your friends and colleague, and you can always comment in the section below if you need help with any part of the Osce. I have already made a lot of videos about planning, implementation, evaluation, and assessment as well, so you can have a look on that as well. All right, have a good day, enjoy, and remember me in your prayers. Take care. Bye bye.